What's the one thing that businesses need to know about the future of healthcare in Iowa? Laura, let's start with you.
Thanks, Tom. So as Tom said, I'm Laura Jackson with Wellmark Blue Cross and Blue Shield, and I have the pleasure of serving on the senior team at Blue Cross, and we serve about 2 million Iowans and South Dakotans and provide health insurance for them. It's a pleasure to be here, and I want to thank the Business Record because it couldn't be a more timely topic. I think when we all said yes, we thought there might be something to definitively to talk about at the federal level, but we can at least talk about, like Tom said, what it really means in Iowa. When I think about you all as business owners, or even sitting in the shoes of actual employers and thinking about how healthcare can change and will change in Iowa, while I work for a health insurance company, I spent about the first 20 years of my career in human resources. On that purchaser side, trying to make sure that we had the right benefits in place for our employees, regardless of the company I worked for. And it really is, it's an ever-changing landscape. So when I thought about the question that we were going to start off with, and then knowing that you all get to have kind of a free-for-all, my thought was to literally tell you what I think literally is going to change. And then I realized if I'm sitting in your shoes, give me like just 3 things. So here are the 3 things I would tell you to watch for in terms of changes in healthcare. So certainly goes without saying the regulatory uncertainty is going to be something to watch. So whether that is tax reform and repealing the ACA, when you think about the HIT tax and all the medical device taxes, how that can impact your plan, the reporting requirements that you all have. Some of that will change, I believe, because I think the burden is very well aware for most of the folks that have a say in that. So when you think about how that impacts us in Iowa, then you're going to ask yourself, what are the trends that are happening in insurance? Well, when I look across both our individual market and our employer group sponsored health plans, there are 2 things that I see happening, and they're happening at a very alarming rate. So years ago, the largest portion of dollars that were spent in healthcare were for folks that were literally put in a hospital. They were staying in a bed overnight, so we call that inpatient. That is no longer true today. Does anybody have a guess? What is the fastest growing portion of the total cost of care? It's prescriptions, right? It's actually the drug portion of it. And we now pay more in prescription drug costs in the total cost of care than we do for folks that are actually put in a hospital bed. So the reason I bring that up is when you think about the trends you need to watch for and things that you can do, you need to watch for technology, and technology enhancements apply to new drugs hitting the market and the ultimate pipeline. So thinking about how you as an employer, what you want to cover, what formulary you want to have in place, that is going to change dramatically. We are going to see drugs hit the market like never before. They're going to exceed our minds about what we think a prescription drug should be worth. So whether that is a $750,000 drug that just got approved for a very small portion of kiddos that suffer from a form of muscular dystrophy, so to speak. So when you look at drugs like that, $750,000 for just 1 year of treatment. We used to have health insurance where people didn't even hit a $5 million lifetime maximum. So the trend is off, the technology is here, and I would tell you the other big piece of technology is we are looking for ways to solve people's lifestyles. Lifestyles have created a tremendous amount of chronic conditions. So when you think about what is consuming healthcare today, it is the chronic conditions that are self-imposed based on how we live our lives. It's what we eat, it's what we don't do with our bodies that we should be doing. So those are the things that you can watch for and that you can do something about. And then the regulatory uncertainty, that's for all of us to shepherd and make sure that we're good supporters of Commissioner Ommen.
Wow.
How's that?
That sounded like a baton passing.
You pick the next panelist.
Ed, why don't you just run down the line?
Sure. Thank you. Ed Oleksiak with Holmes, Murphy & Associates. I've been with Holmes, Murphy 21 years now, 6 years as a client and the last 15 years as an employee. So prior to that, I spent part of that 6 years and another 14 years, 20 years in your chairs, also in human resources. So I bring that perspective also to that. So, our job at Holmes Murphy is to really help our clients manage risk, whatever type of business risk you have, and you do a great job of managing risk. And my one thing I would suggest is that you look at healthcare just as another one of those risks. So, our job is to really look at the marketplace, look at things that the other panelists here are coming up with to help you figure out solutions to manage that cost and that risk. Don't just look at it as a line item expense. Look at wellness programs, look at alternative provider systems that are out there. If we look in Iowa, but across the country, 155 million people get health insurance through their employers. That's the most stable part of the insurance market we have today. Half of the country gets insurance through employers. You're probably in the game to stay. So take it seriously, look at it. You know, I think as you also look at it as not only just a line item expense, but as unemployment continues to shrink, someday we're going to get our employees to realize that the huge dollars we spend in healthcare is part of their total compensation. I don't think they appreciate that today. I think that's an opportunity for us to help them understand employee benefits as part of their total compensation. If something, you know, the Cadillac tax or the employer exclusion where we lose the ability to deduct health insurance comes along, I think that will help people understand that it is part of their compensation. So I encourage you to look at it as part of total compensation, look at it as a risk, and really work hard at engaging your employees as consumers in the marketplace. Thank you.
Dr. Swieskowski, what's one thing business needs to know about the future of healthcare in Iowa?
First, they need to know who I am.
That'd be good.
I'm Dave Swieskowski. I'm a family physician, even longer than Tom has been a family physician. And I work for Mercy Health Network. I'm a senior vice president of Mercy Health Network, and I'm the president of Mercy's Accountable Care Organization. So accountable care organizations are organizations of physicians and hospitals, other healthcare providers that come together who agree to work collaboratively to improve quality and lower cost of care and take risk in doing it. And I think that's my message of what you're going to see in healthcare in the future in Iowa, is you're going to find health systems taking more of the risk in delivering healthcare. There are going to be all different types of arrangements on how we're going to do this. We're going to partner with insurance companies. We're going to take capitated payments. We're going to have cost targets, and if we'll have penalties or rewards if we meet those cost targets. So you're going to see the risk go down to healthcare systems, and when that happens, actually it is happening already, and as it happens, you will see health systems actively working to reduce the number of admissions to their hospitals. So in the past, you have seen, admission was a good thing, and the more we got, the more our revenues increased, and more we're looking at admissions are a bad thing, it's a failure, and we need to figure out why that patient came in and what we can do to prevent them from coming in the hospital. So it's going to just turn our incentives on top of themselves and our behavior on top of itself.
Thank you, Dave.
Good morning. I've been introduced. I am the new commissioner, relatively new. I've been on the job now for I think 5 months, and a lot of it has been healthcare. But I've been in various groups, and I think I need to remind myself from time to time, I regulate health insurance, not health care. A lot of times when I go to meetings, people ask me, what's the solution? And I try to explain, I regulate health insurance, people like Laura, not health care. But nevertheless, we're at the table. We need to be part of the conversation, and I certainly accept that responsibility. If you look at our market, and now I'm talking about health care, more than half our population in Iowa is covered in group or employer-based plans. If you take the Medicare population and the Medicaid population now with expansion, it leaves a relatively small individual market. And it's that market where we're seeing all of our real challenges now. Because the long-term cost problems, there are a lot of people at the table, there are a lot of individuals that need to look at this move to value-based outcomes, the type of efforts to try to control costs. But we have an immediate problem as well. And our immediate problem, which is really finding its way into all of the publications and the news media, is this individual market. And it's something that I think we saw coming. I don't think that there's probably anybody that didn't see it coming over the last number of years, as we've seen the shifting in Washington in terms of what we should be trying to do in health insurance. But we've got a concentration of those people with persistent health conditions, as Laura mentioned, that are concentrated into an individual market. And in Iowa, we can kind of be glad in the sense that because of our history of low unemployment and low number of uninsured, it's sort of a problem we didn't ask for, but that concentration of high-cost individuals in an individual market is really, in a way, because of the strength of our state. It's just that the one-size-fit-all approach of the ACA just doesn't work. It doesn't work. In Arizona, I talked with a good friend of my wife last night, and they're looking at a doubling of insurance premiums. And we aren't quite seeing doubling year to year, but the reality is that you can't continue to raise rates to meet the needs of those with persistent, these chronic conditions, especially with the escalating drug costs, and expect young, healthy people to come join that system. It just doesn't work. So I guess I would leave it with the idea that for an individual market, most people in the business community have access to employer-based plans, but are entrepreneurs, those that are involved in startups, those that we bring to our global insurance symposium, and we encourage them to innovate and to try to do something new. Those are people that have to rely on an individual market. And so it's important for us to get it right. It's important for policymakers to get it right. And I guess I would leave it to most of you in this room to be part of trying to get it right. You can't be on the sideline on this issue. I guess I sort of think of it as, may sound hyper nonpartisan, but this really is not a place where we can have individuals standing on the outside saying, well, it's the other side's fault. We've got to get to a solution.
Sabra?
So I have what I believe is maybe some good news, a bright spot, a little different than what was covered by the others. And it's kind of like Maslow's pyramid. We have what we would like to work on at UnityPoint, and for those of you that may not be familiar with UnityPoint, we have hospitals and physician clinics in 3 states, Iowa, Illinois, and Wisconsin, but concentrated really here in Iowa. So across the state, our hospitals and doctors are serving you and serving your employees, and we want to continue to do that for a very long time. We're working on patient experience, and what we mean by that is when you come into the doctor's office, not waiting 20 minutes to see your doctor, maybe not coming into the doctor's office to have to see your physician, and really modernizing healthcare to what the consumer is seeking right now. Just like they can go to the ATM and get cash right out of the machine, why can't we have these quicker, faster, more consumer-friendly interactions in healthcare? So that is really what we'd like to spend a lot of our time working on. Unfortunately, right now, we have a little bit of a trifecta going on with our reimbursements that come into our UnityPoint Health system. We, for example, in Iowa, we have served about 50,000 more Medicaid patients within the last 3 years since the Medicaid expansion passed under the ACA. As you can imagine, that has created quite a tax on, no pun intended, on our health system of getting all those patients into the primary care office and even into hospitals to have their care. And with Medicare, Tom mentioned all the changes with Medicare reimbursement. That as well is a strain right now on healthcare providers to figure out how to comply and change their systems to comply with that. And the latest kind of tension in the individual market and the market not being stable. So we're looking at a time of real uncertainty when it comes to reimbursement with both our hospitals and our physician clinics. And so I think access to us, access for our patients, access for your employees is really top of mind for us, and is what we will be working on as a large nonprofit in the state, is to continue access for all of our patients.